Փայրգուն բոլորիդ, ինչպես գիտեք, այսօր երկուշաբթի օր է եւ ամեն երկուշաբթի օրը 7-ին 7:30 ես բժիշկ Harout Khanjian, California Eye Center։ Այսօր ցեզի համար շատ հետաքրքիր հաղորդում ունիմ եւ ով որ այսօր գոբերու մասին սպառված է կամ գոբերու մասին հարցում ունի կամ առաջին անգամ լալով facelift, որ երեսը տարիներով կսկսի իշնալ ցած, ոչ թե մինակ գոբերը այս մասերը, այս վիզի վրայի գախված միսերը, այդ բոլորը այսօր մասին պիտի խոսենք եւ իմ հետս, իմ հյուրս արդեն դուք գիտեք տարիներ է մեր հետն է, ինքը USC Medical School professor է, աչքի գոբի մասնակետ, իմ հետս է այսօր California Eye Center-ի գոբերի բաժինը Dr. David Samimi. How you doing, David?
Wonderful.
It's been a while. Where have you been?
Great to be here. Great to be here.
We had Dr. Bernstein on. We have you on today. So this is such a hot topic. Anything with beauty, anything with looking young, the Armenian people, they love it.
Armenians, Persians, all the Middle Easterners.
We all love it. And so I'm sure they're all watching the TV show right now saying, Samimi, that's my doctor. That's the guy who made me look 10 years younger. And I want to thank you because I will get calls and I know they're going to say, I want to say thank you. I want to say thank you to Dr. Samimi.
Oh, that's so nice.
On their behalf now, just to save some of those calls, thank you for all the wonderful work you've done in the community. I hear it back at our clinic. They tell me, thank you, Dr. Khanjian, for sending me to Dr. Samimi for a wonderful, fantastic job.
Well, it's a pleasure, and I appreciate the confidence that patients give to us. It's really a blessing to be able to do what you love and have patients trust you to do that. So
absolutely. Միշտ մեր բժիշկներու մասին գրնակ տեսնալ, եթե online երթակ, մենք website-ին վրա www.calicenter.com, եթե երթաս specialists we work with, այստեղ գտնակ Dr. David Samimi-ին, իրեն մասին քրվեր է արդեն գիտեք ինքը USC համալսարանի պրոֆեսոր է գոբերու մասին եւ հազարներով գոբի կորզողություններ է որ աչքի եւ երեսի հետ կապված է եթե իդ ստուդիո գրնանքալ այսօր շատ հետաքրքիր հաղորդում ունենք որ փամեն է որ ինքը այսօր պիտի խոսի ավելի facelift-ի մասին առաջ մենք միշտ գոբերու մասին կխոսենք բայց գոբեն զատ ուրիշ մասեր կա մեր աչքին երեսին վրա որ կսկսի տարիներով փոխվի Տարիքով գսկսին ջմրտկվիլ, տարիքով գսկսի գոբը մաշկը իշնալ։ Ուրեմն ատոր մասին պիտի խոսենք այսօր, բայց առաջ որ սկսենք ինքը մեզի քիչ մտող բացադրե ինչու համար մեր մորթը կփոխվի տարիներով։ So before we get into the topic, I'm sure a lot of our viewers want to know why does our skin change as we get older? Why do things begin to move? Why do we get these wrinkles? Why do we get this discoloration? We always want to look as young as possible, but sometimes no matter what we eat or what creams we use, what expensive stuff we buy online or on TV, it just sometimes is enough. Why is it that these changes happen and we start to look older?
Yeah, it's a very good question, and I've actually put a lot of thought into why is it that we're seeing what we're seeing on the aging face. Commonly on the eyelids, that's one of the first places to show age on someone's face. And so that's why we see the aging face the soonest in our clinics. And most people think, oh, well, look, I have extra new fat here in this bag, or I have new skin that's kind of here. And it's true, the skin is a bit looser. So part of it is just, with aging, the collagen in the skin, the elasticity, and the environmental changes from sun and stuff like that does make the skin looser. But what's really going on is a little bit more nuanced, and you'd have to kind of understand how the face is aging to understand why we end up having the skin that looks kind of loose and sagging. So the big thing to know, which is kind of interesting, it really took me like 10 years to kind of understand this, is that a young face, kind of has this V type of shape. It's thin here, and it has kind of nice high cheekbones, and it has some projection to the brow. As we're changing, and we know this now, looking at CT scans and X-rays, every decade, the temples and the brows and the lateral cheeks are starting to cave in. And you can look at a skull, the skeleton, the skeleton is actually shrinking here and expanding here. So the bone changes, as well as the fat. We start losing some of the fat that was in those areas that was inflating the skin and making it look tight because it was inflated.
Yeah.
And so, you know, on the eyelids, usually you start seeing fat bags here, and usually that's not new fat. It's not like the fat we get in our belly from, you know, eating too much kebab.
Yeah.
It's the same fat that's always been there, but the difference is, as we're aging, the ledge, like the bone that used to be here, which was in front of the fat, it starts receding back.
Yes.
And then the fat that was always there is now hanging over the ledge. And so the key is, how do we get results that are natural looking? And we get that not by just, you know, sucking all the fat out or cutting all the skin out, because it just kind of, you know, shrinks that structure, but we try to resculpt the shape of a youthful face, which is to tighten the neck and to expand, you know, usually the cheeks, the brows, and take the fat instead of taking it out, kind of moving it into the cheeks. So these are all concepts that we apply to the eyelids, and you can now control the whole face, which I'm really excited about, when you can control the lower face as well.
Got it. Thank you, David.
Sorry for that 15-minute...
No, it's good. I know there's this new technique that there's only a few people in the world that know how to do, and you've mastered this technique, and you came on the show today to talk to us about it. And I know no matter how much you talk about it, it's not like somebody can go tomorrow and do it and copy you.
Right.
It's a technique you've mastered and practiced, and you're here to share it with us today. And I'm sure a lot of our viewers today will definitely make use of what you're about to teach us. And hopefully, if anybody that needs to benefit from it can contact us, and we can be able to see if you can do anything for them.
Would be an honor.
Tell us about what you have today.
So the way to get results that are, you know, out of this world, which for me means safe and natural looking, to do that, it's first best to understand what's going on. Like what we already kind of talked about, how the facial shape is changing from, you know, the V like this kind of to inverted here. So I had actually a really nice Middle Eastern mother and daughter group that came in, and I thought they really showed the example of what it is that you're seeing. As you can tell, you know, here is a...
This is mother and daughter.
Mother and daughter, yeah. Here's the mom, and here is the daughter here. You can see in the daughter, the face is fairly slim down here, and it's wide up here in the brows and in the cheeks. Now, when you come over and you see the same family, what's happening is the lower face is becoming, instead of kind of a heart, this is kind of a square, and it gets wider down here. And then what you notice is that it gets hollow on the cheeks and the temples. And so this facial shape is getting flipped and inverted. And so with the eyes, like I said, we try to restore some of the volume that is gone in the temples and the brows. But in the neck, a good neck and facelift can also slim the lower face. So let's take a look at a picture. Here's a patient. She was bothered by a few different things. One, she has kind of some loose skin on her upper eyelids. She has a little bit of bags on her lower lids. But really, she's bothered by this, what we call the jowls, this kind of like little bunching of tissue right in front of the chin. And then this kind of turkey neck, these bands that are moving along the center. And a good face and neck lift is really good at improving these two things. It's really good at improving the jowls as well as the neck. So let's take a look at this patient. This is her before, and this is her after. And after, what we've done is change the shape of the face from it looking kind of like it's a square to making it more of a heart. You can see the kind of contours. Those jowls are gone, the neck is smooth, the bands are kind of gone there. And I also lifted her brow a little bit. You can look at the shape of the brows a little bit different. It went from kind of round to having the tail being up. And I took the fat in her lower lid and I moved it down into the cheek and took a little pinch of skin. And so overall, she just looks like a younger, more refreshed version of herself, which I'm very proud of.
Yeah. Looks like she just came back from vacation.
Yes.
Like a nice 2-year Hawaii vacation.
And when my, if she was living the Harout Khanjian lifestyle, she'd be in Hawaii, every couple months, I think. But what I love, my favorite thing to hear from with my patients is nobody can tell what I've done, but people are asking me like, wow, you look great. Did you change your diet? Did you get some rest? Did you go on vacation? And that for me is like, this is a win. This is exactly what we want, and it makes me so happy.
Yeah, that's excellent.
So let's look at how we get these results. I have another image here, and this kind of tells you how it is that we do what we do and what's different. A typical facelift makes an incision that's kind of here in front of the ears and then goes up and behind the ears. But most facelifts, they dissect the skin all the way down into the cheek, and then this is the muscle, the pink is the muscle. They pull the muscle in one direction, and, you want to go back? And they pull the skin in a different direction. And by doing that, patients look unnatural. So this facelift, what's great about it is I only go under the skin a couple of centimeters here, and then I go deeper underneath the muscle, the superficial muscle of the face, and we leave the skin connected, and then take that muscle and kind of move it up here, and in the neck, we make a little incision right underneath the chin, and we take that muscle, this is what's causing those bands in the neck, and we suture it together so it gets tighter here. And then we kind of pull it up from the back also and suture it behind the ear. That way, the foundation, the structure of the face underneath the skin is what's repositioned, and the skin is naturally brought along with it. Mm-hmm. So, using these principles, this is how we get these amazing results. And this is a patient who had a facelift 5 years ago in Beverly Hills by somebody that does what is mostly the standard facelift technique. That is making an incision in front of the ear, kind of tugging on the muscle a little bit, and then pulling the skin. But when you look closely, she still is left with these jowls here. She has what we call a cobra neck deformity. Her chin looks like a cobra snake because fat liposuction was done as the main reason to try and tighten things. But if you don't restructure the foundation and you don't tighten the muscles, then this is just going to sag again. And only a few years later, you can see she was unhappy with how she looked. She has these bands, she has these jowls, and if you look closer, which I'm going to show you on the next one, you can see that she lost her earlobe. Yeah. But this is after the revision surgery that we did. We gave her neck back. You can see her neck. You can see her jawline. You can see her ear. And the face volume shifted from down here to up in the cheek. And I can show you on this next photo, you can kind of take a look at what happened to the ear. This is what a classic and most facelifts look like. The ear gets connected and stuck to the cheek because there's tension on the wound. When there's tension on a wound, it pulls down and it causes scar. And when you're using the skin to do some of your lift, which is what most facelifts do, you're then stuck with having scarring and possibly an ear that is not full. So this is after we did the surgery. We gave her earlobe back. She now has the natural kind of contours of the ear, and you can see the scarring is essentially in front of the ear, invisible. Here's another angle of the same patient. You would never know she has such a beautiful neck underneath all this kind of loose skin. But when I'm evaluating a patient in the clinic, I'll take my fingers and raise up their cheeks and kind of pull from the back, and I can see, if I kind of do this and do this, maybe that's what the people at home can kind of do. They can kind of take 3 fingers, lift here, yeah, and see what happens to the jowls. And if those disappear, and you kind of put your thumb back here, and you have a nice neck underneath there, you're usually going to be a great candidate for a neck lift.
Yeah, right.
I don't know if you want to translate some of this, or I could talk forever about this.
No, they understand. I mean, these pictures are fantastic.
Can I come back behind you and show what it would look like?
Yeah,
if
you can.
All right,
if
let's
you'd
do
like.
it.
Yeah. See how that would look.
Typically, the thing that I'll do is I'll come here, I'll put my hands right underneath, and I'll kind of lift. And that is how you get a vertical lift. This is a vertical lift, because a lot of facelifts are horizontal, and it looks kind of like this, like you're in a wind tunnel. Yeah. We like to avoid that by having the lift be vertical, and then usually kind of pulling back here.
Yeah.
So we'll make you, if it's possible, make you look even younger than you look, even though it looks like you're getting younger every time I see you.
Yeah, this is absolutely amazing stuff, David. I mean, it's definitely technique that they did not use before. Like you said, they would pull the muscle in one direction and the skin in another. And she basically lost her earlobe there, and I didn't even notice that.
Right,
you know?
right, exactly.
Okay.
And so for me, I really didn't want to do neck lifting techniques because most of the ones that I saw were looking, you know, kind of like this. And being as good as we've gotten on the eyelids, to be able to do it naturally, safely, I was really proud of that. And I said, I don't want to end up doing another technique that's not going to kind of have that. But once I found this technique and I realized, wow, the face can be done with the same finesse and skill that we do with the eyelids, I was kind of hooked.
Right, right, fantastic.
So maybe we'll show a few more
let's see.
examples. All right. So here's the same patient, and you can see her on the frontal view. We'll go to the computer there. And she's a great example of showing the change in the facial shape. You see, she was square here. This is kind of, you know, like a square jawline. And after we restored the natural position, her face got this heart shape. And it kind of brought, it's like bringing that mother back to the daughter's shaped face.
Mm-hmm. Yeah.
So here's another one here. This is, you know, it's not only women that have this, men certainly have it as well. And, you know, here's a gentleman where you can see he has the classic signs of lower facial aging. He has some jowls here. He has some kind of loose skin bands. And with this technique, we gave him his jawline back, essentially moved that tissue that was down here, kind of moved it up to fill his cheeks. And, you know, if I didn't tell you that he had an incision here, you probably wouldn't even see it. And it even blended more later. But even without hair, it just blends in so well when there's no tension. And so here is the same patient on a frontal view. And this is
so different.
With a combination of the neck lift, bringing those jowls up. But what I did next is I added icing on the cake, and I added fat and something called Sculptra to fill in the hollowing that you see on the periphery of the face here. And by doing that, you kind of make those shadows and the contours just go back to a youthful face. And what I love about it is he doesn't look stretched or pulled or done whatsoever. He just looks like a handsome, younger version of himself.
Definitely looks a lot younger in that picture.
So that's why I'm really excited about the technique, and, you know, that's the last one.
Yeah. All right. Studio Garnankal. Thank you, David. That's absolutely amazing what the technology has come to date. I know a lot of the patients are thinking, does Medicare cover this?
Wouldn't that be nice?
Wouldn't that be nice?
I think in some countries like, you know, Brazil and Venezuela, I think cosmetic surgery is like a right. Everybody should have it. Yeah, some of it's covered. But yeah, the United States hasn't yet done that. So everybody put your ballots in and make sure you do your voting tomorrow. Who knows? Maybe we can get that changed.
We can get it covered. A new proposition to have this covered. But again, Medicare will not cover this, right? It's considered cosmetic surgery.
Cosmetic surgery.
And then what? Just a little bit on the guidelines on what Medicare would cover versus not cover.
Sure. So in general, if things are affecting your activities of daily living, you know, you're like from the eyelids, if the eyelids are covering the vision and it's making it difficult for you to drive or cook or whatever it is, you know, these are certain things that Medicare will say, okay, this is medically significant. But just having loose skin, just having bags under the eyes, or, you know, having the kind of jowls and loose skin here, this is not something that's affecting your ability to lead your life, and so it's not considered medically necessary.
Right. Okay. So just to recap, upper eyelids, if they droop and they're in the line of sight, it's covered. Lower eyelids, if they're puffy and round, no matter how big and puffy they are,
Never covered.
Right? And then the facelift we talked about today, none of that would be covered. It would be considered cosmetic surgery.
Exactly.
Right? Okay.
Yeah.
Got it. Now,
and if they pay extra, I can have them look like Harout Khanjian. They need to give millions of dollars to look this good.
This is a lot of hard work for almost 4 years. Yeah. But and then, David, another question they might have: any over-the-counter creams or any kind of dietary foods or any lotions or anything that you recommend, that you've tried, that you can pass on to the viewers?
Sure.
Just for, you know, overall skin protection, and SPF is always a good thing. Now we're in the winter months. Although cloudy, we still get some
still
UV
get
rays.
some UV radiation.
So ultraviolet light does play a toll on our skin. Causes cataracts, causes skin cancer,
Right.
causes these skin changes.
Absolutely.
So what's a good SPF, for example, to use? Like a 30, a 40?
You know, you raised some really good points, and there's a few things you can do to really help. And the number one, like you said, the cornerstone is going to be SPF, something that really controls the UV radiation. The most important part is that it's a mineral sunscreen and not necessarily a chemical base. So the mineral-based sunscreens absorb better. Those have zinc oxide in them. So something, you know, at least an SPF 30, but as long as it's a mineral base, you're good. The three other things that have been shown to clinically really improve and prevent a lot of the aging process are going to be antioxidants. These are usually vitamin C type of serums. Growth factors. These are factors that tell the DNA in cells to rebuild collagen. And then a retinol. This is something that actually speeds up the turnover of the cell, so you kind of get fresher skin faster. So you get the biggest bang for your buck in terms of how much money you're spending by investing first in those: sunscreen, retinol, growth factor, and an antioxidant like vitamin C. And then the number one thing people can do if they're smoking is stop smoking.
Yes. Cigarettes do make you look older. Absolutely.
Yeah. Right.
So again, vitamin C.
Topical.
Topical. They sell it at Costco. I've seen them over the counter and so forth. Some kind of growth factor, right? And a retinol. And
Correct.
I know they come in different. They come in a 0.5, a 1.
1.0, yeah. And my recommendation with the retinol is typically to start on a low dose, and what you're gonna do is try and work up to doing it every night. But the issue is it really will dry out your skin. So start once every 4 nights and put moisturizer on in the morning, and then slowly taper up to whatever concentration you're using, 0.5, whatever, until you get to a point where you can do it every night and your skin's not kind of flaky and red. And then if you want for a while, you can try a stronger strength. But that's going to show you clear results.
Right. And then the SPF to protect yourself from the sun so you don't get more of the aging. Stopping the cigarette smoking so that you can, the cigarette will cause you to look older.
Absolutely.
And then the vitamin C, and then the retinol.
That's right.
Got it. Yeah. And how about any food, dietary intake? Antioxidant-based
Sure,
meals,
yeah, antioxidant.
like salads.
Yeah, a lot of green leafy vegetables, things that will help, the damage that happens to the skin kind of get improved. And exercise.
Exercise does help with skin.
Absolutely.
Yeah.
Yeah.
Okay, very good. I think this was a pretty informative show. Ուրեմն գուզենք ցեզ մելսել իմ հետս այսօր Dr. David Samimi մեր oculoplastic eye aesthetica division-ն արդեն մի քանի շաբաթ առաջ, մեկ ամիս առաջ Dr. Bernstein-ը մեր հետներ խոսեցավ գոբերու մասին։ Իրենք Samimi, Bernstein, Dr. Wang-ը բոլորը նույն խումբն է, որ մեր գոբի բաժինն է California Eye Center-ին։ So ով որ մեր կովը կա եւ գուզե գոբի կորզողություն ունենա, ես միշտ գոբի մասնագետների կուտամ։ Շատ անգամ հիվանդներ կտեսնանք, որ գոբերնին վիրահատեր են եւ այս անգեն չեն գրնար աչքերնին կոծել այնքան որ գոբը բարձրացել է, որ հիմա dry eye խնդիրներ ունին։ So շատ կարեւոր է եթե գոբդ պիտ վիրահատեք կամ երեսի պիտ վիրահատեք, միշտ oculoplastic surgeon, աչքի մաշկի մասնակետ։ So oculoplastic surgeon, Dr. Samimi, eye aesthetica, ինքը մեր խումբին կպատկանի։ All right։ Ուրեմն ցեզմե լսենք Hello, ինչպես կրնանք օգնել։ Բարև ձեզ։
Դոկտոր ջան, ես մեքենա քշելուց գիծերը խառնում եմ իրար, այսինքն տելևիզիոն ու նայում եմ երկու հատ եմ տեսնում, ինչի՞ց կարող։
Yeah. Այն double-ը որ տեսնում ես, աչ ու ցախ է կամ վեր ու վար է double-ը։
Չէ, աչ ու ցախ։
Աչ ու ցախ։ All right։ Այսի նորը սկսավ մի քանի շաբաթ, մի քանի ամիս կամ երկար ժամանակ է։
5-6 ամիս է։
All right. So ամենաբարձ պատասխանը կրնալալ աստիգմատիզմ կա։ Աստիգմատիզմը կրնալալ ունենաս եւ ակնոցի միջոցով շտկենք։ Կամ կրնալալ կատարակտը սկսերը, որ կատարակտը արդեն կսկսի double vision։
Չունեմ, 2 տարի առաջ գործողություն եմ։
Perfect։ Ուրեմն եթե կորզողություններ ես, գրնալա կորզողությունեն վերջը astigmatism մնացերը, որ իրգունները գրնալալ at double vision-ը դա եւ օթոների լույսերուն եզերքը խանգարե։ All right. Արդեն մեր ժամանակը մոդեկցավ. Thank you Dr. Samimi.
It was a pleasure. Thank
Շնորհակալ
you.
եմ բոլորիդ։